Hi, this is Lloyd with AVS Medical. This short video is designed to show you how to manually create a clinical encounter for the purposes of meaningful use reporting. When you're entering information about your patients into the EMR for meaningful use, the presence of a clinical encounter is required. That's what allows you to document information for your meaningful use reports. Most practices that have been using their EMR for a while are having the clinical encounters automatically created from the schedule. When the patient is checked in, it automatically creates a clinical encounter for that patient. However, if you're just beginning your meaningful use, you may not want to create a clinical encounter on all of your patients. You may just want to be creating them for a few patients a day while you're learning the process. So this video is designed to show you how to manually create a clinical encounter. So it's real easy to do. You just open up the patient's chart like the one you see here, and in the upper left hand corner you click on the Show menu right here. Come down and click on Clinical Encounters, and this brings up the Clinical Encounter screen. I don't have any here, so I'll just click New, and this brings up the Clinical Encounter Maintenance screen. Today's date, the time of day, the type of office visit, the provider ID. Now, I'm not logged in as a provider, but when you log in, your provider ID will be here. And all we do now to create it is simply click OK. However, before I do that, if you're doing medication reconciliation as one of your meaningful use objectives, and many of you are, then you want to come up here to the transition of care type and check inbound. So in order for a medication reconciliation to occur, the clinical encounter has to be marked as inbound. We'll talk about medication reconciliation in another video, but if you're going to do it, make sure that's checked as inbound. So at that point, all you do is click OK, and now we see the clinical encounter has been created. Click Close, and then chart our visit and enter the information that's pertinent for meaningful use. That's all there is to it. Thanks for watching.